Hello and welcome to my YouTube channel Professional Lectures. Dear viewers, I hope you all will be fine. This is my last video on my YouTube channel Professional Lectures because in this lecture I will complete my all topics of pathology. Dear viewers, in the previous lecture I had already discussed the definition of pathology, the introduction of pathology, plus I had discussed the scope of pathology, etiology of pathology, and different other topics like cellular injury, adaptation, homeostasis, necrosis, calcification, pigmentation, inflammation. I had discussed all the topic of pathology. Today I will discuss the cellular events and chemical mediators which are present, which occur in the acute inflammation. So before I start my lecture video, I kindly request you to please subscribe to my YouTube channel and press the bell icon to receive the notification of my latest videos. Cellular events are the major function of inflammation is the transport of inflammatory cells to the affected area to control infection. Following are the types of inflammatory cells like neutrophils, lymphocytes, eosinophils, and monocytes, macrophages. These all types of cells are inflammatory cells which occur in the acute inflammation. So neutrophil most prominent cell in the acute inflammation, particularly during first 24 hours. Lymphocytes prominent in viral infection and chronic inflammation. Eosinophil prominent in allergic reaction and parasitic infection. Monocytes after 1 to 2 days also involved in chronic inflammation. Macrophages and neutrophils are replaced by monocytes after 1 to 2 days, also involved in chronic inflammation. So sequence of cellular events. Following are the cellular events in the acute inflammation like margination. In this process, inflammatory cells try to localize in the outer margins of blood flow near to the vascular endothelium. Addition in this process, the inflammatory cells attach to the endothelial cell. It is due to the presence of adhesion molecules on the surface of both cells. Immigration in this process, the attached inflammatory cell actively leave the blood vessels through the intercellular junctions along the endothelial surfaces. Chemotaxis in this process, the inflammatory cells are attracted and moved to the site of injury. This is due to attraction by a chemical substance at the site of injury called chemotactic factor. These factors are bacterial products, complement components, especially C5a, leukotrienes, phagocytosis. In this process, the microorganism and other injurious agents are engulfed and destroyed by the inflammatory cell. It consists of 3 steps like recognition and attachment, engulfment, killing, and degradation. So chemical mediators, these are the substances that are involved in the vascular and cellular events in the acute inflammation. These are of following types like vasoactive amine, plasma proteases, arachidonic acid metabolites, products of leukotriene, and other miscellaneous. So vasoactive amine like histamine is secreted from mast cell, platelet, and basophil. Leukocyte, serotonin, it is secreted from mast cell and platelets. And so its function is increased vascular permeability and vasodilation. Plasma proteases kinin system, for example, bradykinin function, increased vascular permeability, vasodilation, smooth muscle contraction. Complement system, this system has components that are protein in nature. They are present in plasma. Function are increased vascular permeability, chemotaxis, opsonization, and lysis of target organisms. Coagulation, fibrinolytic system, this consists of 2 systems that are clotting system and fibrinolytic system. Stimulation of clotting system leads to clot formation, while the fibrinolytic system at the same time is activated to counterbalance the clotting system. Arachidonic acid metabolite, prostaglandin, product of cyclooxygenase pathway. Its function is pain, vasodilation, inhibition of platelet aggregation. Leukotrienes are the product of lipooxygenase pathway. Its function is chemotaxis, vasoconstriction, bronchoconstriction, and increased vascular permeability. The product of leukocyte platelet activating factor. This factor is released from the membrane phospholipids of WBCs, endothelium, and platelet. Function are platelet aggregation, vasoconstriction, and bronchospasm. Lymphokines, cytokines, these are the soluble proteins that are released from activated lymphocytes, macrophages, and some other cell, for example, interleukin 1, tumor necrosis factor, gamma interferon. Its function is to change or adjust something, modulate the function of other inflammatory cell. Lysosomal enzyme, these are released from neutrophils and monocytes. They help in the acute inflammation, for example, acid and neutral proteases. Its examples are oxygen derived free radicals. Clinical signs of acute inflammation, there are 5 major clinical signs of acute inflammation, like heat because of increased blood flow. It is also called Cellular. Robur, which is the redness because of increased blood flow. A tumor is swelling because of fluid collection like exudate and transudate. A pain, dolor, because of chemical collection at the site of injury. Loss of functionlesia, which is due to the due to the injury of the tissue. Systemic effect of acute inflammation. In acute phase, reaction is the collective name for the systemic effect of acute inflammation. Important mediators are the interleukin 1, tumor necrosis factor, and interleukin 6. Acute phase reaction include anorexia, hypotension, and weight loss, fever, leukocytosis, raised ESR. So this is all the changes, all the vascular change, cellular changes which occur in the acute inflammation. Plus, I had also discussed the chemical mediator which are released in the acute inflammation. So this is all about my today lecture. I hope you will understand my lecture. I hope you will like my video. I need your support so you can support me by liking my video and subscribing my YouTube channel. Subscribing my YouTube channel Professional Lectures, and plus if you are interested in watching my further videos on my YouTube channel, then you have to subscribe, then you have to press the bell icon and subscribe my YouTube channel Professional Lectures. Thank you so much for watching my video. Thank you. Take care of yourself and goodbye.